Dr. Joel Simmons here from Ohio Herbal Clinic. Today we're going to talk about maximizing usage of your card and some issues with renewing the medical marijuana card. I've been getting a lot of questions lately, a lot of misinformation out there being told to patients. So I wanted to try to clean up and clarify a lot of things. So let's start out with the length of use of your card. Each card has a maximum length of use of 360 days. That's 360 days. It's very important to understand this number and how it applies to the dates that are on your card. So potentially, if you were issued your card and given the maximum number of refills possible, it would equal 360 days of usage. So typically you get an initial 90-day supply, and in some instances you can have up to 3 refills. So that is 4 90-day supplies. They total 360 days of usable days that you could purchase from a dispensary. It's extremely important to understand this concept. 360 days, I can't say it enough. So in a situation where someone was issued their card back on February 6th of last year, I can tell you that that card is going to arbitrarily have an expiration date printed on it of February 29th of this year. That is way more than 360 days. So the real expiration date in terms of being able to use the card would be to subtract approximately 5 days from February 6th, so it'd be more like February 1st. It would be 360 days of usage when the card would actually die. So from February 1st until February 29th, all the patient could do would be to go into the dispensary and window shop, essentially. But there's no purchases that could be made during that time period. This is very important to understand because a lot of people are showing up at the dispensary and their card is cashed out and they don't understand why, and it all goes back to the up to 4 90-day usages. So what happens when you go to dispensary and you have no more days left? It's typically one of 3 scenarios. The first thing I would tell you to do is look at when your card was issued and look at the date on the card when it's supposed to expire. If that issue date and expiration date are close within a month or so, then you've had your 360 days, okay? So your card is expired. Now the next step is very important. You must have an in-person visit with a qualified certifying physician to have your card renewed. So for those of you who are at a dispensary calling, what can I do about my card? If you're past your 360 days, the only thing you can do is schedule an appointment and get in front of your physician so you can have your annual visit and have your card renewed. There is no, I've had dispensaries tell people, well, your doctor can call in and give extra days to get you by. That's not how it works. You need to follow up with your doctor and have a visit. So if you're in that scenario where it's been 360 days since you got your card's tapped. You need to schedule an appointment. Don't call, don't do anything except go online if you're one of my patients and schedule an appointment to come in so that we can renew your card. The second scenario in which you may not be able to use your card, you don't have any days left of usage, would be as if your refills on your card ran out. So if you're looking at your card, the expiration date is a few months down the road, yet they're saying you can't use your card, and you haven't made any significant large purchases or anything recently, then what's going on is you're out of refills. If you're one of my patients, you need to come in to have additional refills issued to you. You need to schedule a follow-up patient appointment and have additional refills issued to you. This can get a little complicated because we do have some patients here in my clinic that are on more of a 6-month rotation than a 12-month rotation. So if you're coming in at about 6 months from when your card was issued, there's no problem with us issuing you another 6 months, but we cannot issue more refills than what that set expiration date is on your card. If you're coming in at about 7 months when you should have been in here at 6 months, then what happens is there's only 5 months left until your expiration date on your card, and we can't issue you 6 months worth of refills. We can only issue 3 months, because if we issued 6, it would go past the date on your card. So that the date on your card is important in that sense, in terms of the ability to issue refills. It's incorrect in the sense of you have 360 days of usage. So everybody's situation is a little bit different, but you really need to understand your days of usage. The dispensary should be giving you that information when you're making your purchases. You can ask them, do I have refills left? You can ask them how many days of usage I have left. Now the third scenario is when you know that you have refills left, but you're not able to purchase, your card's not expired, you have months left on your card. That's a situation that has to do with how you've been purchasing. For most people, that's only a situation they're going to run into when they're purchasing small amounts of flour frequently. And that's a loophole that they're trying to close, and that's been discussed elsewhere. But in that situation, you're just kind of locked out. And the only way that you can get out of that is time has to elapse and days have to fall off so that you can resume your purchases. That is something the dispensary should be telling you about. So to recap all of this, the dates are important. We talked about 360 days of usage of your card. 360 days, that's what you have. So you should be able to look at when your card was issued. You should be able to look at how much time has elapsed. If you're over 360, you need a new card. To renew your card, you need to see your physician in person. There's no telemedicine that can do this, not by state law. There's nothing you can do without coming in to see the doctor in terms of just logging into the registry. You need to schedule an appointment and see your doctor so that you have that annual visit and you keep that bona fide relationship with your physician. You need to do that, which is part of this program. I hope that's been helpful. Really wanted to address this situation. It's very confusing, a lot of misinformation, but I've tried to also explain this on the website. If you looked at the frequently asked questions, OhioHerbalClinic.com, I go through the scenarios in written form if you're not catching it from the video. But I hope everyone is enjoying the program. I think some kinks are being worked out, but there are these little loopholes in here that are catching people up, and I just wanted to take the time out to explain them. All right, you guys take care.